Hi, this is Dr. Woeller for the Candida Mastery Course. Title of the short video is High Oxalic Acid, Kidney Stones, and Unexplained Body Pain. This is actually a case presentation. Now, this is an example of content found within our Candida Mastery Course, which is a very in-depth course in different aspects of Candida, candidiasis, invasive Candida, etc., looking at lab testing, looking at pathogenicity mechanisms, treatment options, etc. So one of the things we pick up by using organic acids test, which we will discuss and do discuss in the Candida Mastery course, is we can find various chemicals linked to the invasive nature of Candida. But there's other markers that show up on this test too that can be linked back to Candida as well. So on page 1 of the organic acid test, there are many markers that look at different yeast and fungal species. So for example, if we look at number 7, arabinose, this is actually linked to invasive Candida. So what happens is Candida is producing enzymes that break down hyaluronic acid, and then we get an expression of arabinose because of the invasive nature. We can find other yeast markers, citramolic, 3-oxyglutaric, carboxycitric. There's actually markers for mold. So markers 2, 4, 5, and 6 are actually linked to Aspergillus mold colonizing within the digestive system. One of the other things we'll often see elevated as well is high levels of oxalic acid, which a main risk factor for that over time would be kidney stones. But the thing about oxalic acid is it may not necessarily lead to kidney stones, but it can lead to body pain. So this was a 43-year-old female who presented with pressure headaches, fatigue, brain fog, body aches, and tendon pain. She actually had cyclical urinary pain as well as digestive discomfort, particularly with bowel movements. Now, she had been diagnosed with some parasites and also had been mentioned to her that she might have irritable bowel syndrome. Now, one of the interesting things in her case was that she noticed severe muscle pain when she ate certain nuts and vegetables. So an organic acid test was done and it showed very high levels of oxalic or oxalic acid, also called oxalate. We know that oxalates can bind with minerals like calcium, create a calcium oxalate stone, which can deposit in your tissues, in your joints, triggering inflammation. It can actually be linked to urinary discomfort as well. So oxalate crystals are a big problem. We know, again, in a very, very severe form, it can lead to kidney stones, but you may not get kidney stones, but you can still have crystals accumulating, generating inflammation and causing pain. And so what ends up happening is when oxalic acid loses its hydrogens, it becomes an anion carrying a -2 charge, and it will complex with a cation carrying a +2 charge. Now that could be magnesium, that could be zinc, calcium, other minerals, but mostly mostly calcium. So kidney stones are certainly a risk factor for this long term. Now, a lot of people will drink vegetable juice that is either with things like kale or spinach, for example, and that can be extremely high in oxalates. And there are other foods, soy products, nuts, berries, for example, that can also be high in oxalates as well. So it's not uncommon to see people who have high oxalic acid picked up off of an organic acid test to have bladder irritability, vulvar pain, urethral pain, pain on urination, for example, but no confirmation of infection. Many times we'll see kids, particularly special needs kids, who have eye pain or behavioral issues, fibromyalgia-like discomfort, body aches, burning feeling in muscles. And then mood disorders can actually be linked to this as well. So the main source of oxalate for many people can be diet, particularly if they're eating a diet high in oxalates. But an undiagnosed yeast and fungal problem can be a major contributing factor as well. I've already mentioned how Candida produces enzymes that break down hyaluronic acid. They can actually break down collagen as well. And the breakdown product of collagen is hydroxyproline, which feeds into the oxalate metabolic pathways and can contribute to the circulating pool of high oxalates in the body. You pile on top of that added dietary oxalates, and now you have a real issue. It turns out that Aspergillus mold can also produce oxalates. Candida has its own metabolic system, and Candida produces an enzyme called isocitrate lyase. And what isocitrate lyase will do is it will complex with isocitrate as part of its Krebs cycle, its mitochondrial activity, and it'll convert isocitrate to glyoxylate. Now, glyoxylate in the human body can get converted to oxalate, okay, through different metabolic enzymes. So that's the link here between Candida and the formation of oxalate. Aspergillus mold has a different mechanism. So when we're looking at anybody with high oxalic acid, we're not just looking at diet, but we're also looking at contributing factors with regards to Candida and also the existence of mold, because many people who have underlying chronic Candida problems can also have underlying mold issues as well. So the organic acid test gives us great insight into these issues. So for more information about the Candida Mastery Course, what it involves, different topics, looking at the syllabus, etc., go to candidamasterycourse.com. Again, I'm Dr. Kurt Woeller for the Candida Mastery Course. Thank you.